Our next topic is airway resistance. In this case, it's mostly going to be related to the radius of the conducting airway. Remember that according to Poussier's law, the radius is the most important factor determining airway resistance. And for a given pressure, airway resistance is going to be an important determinant of airflow, how much air can be moved per unit time. This is partly under autonomic control, where the sympathetic nervous system is going to, what do you think, dilate or constrict airways? During a fight or flight response, would you want to make it easier or harder to move air in and out of the lungs? Well, you would like to dilate the airways to make it easier to move air. The parasympathetic nervous system, on the other hand, causes constriction of airways. Airway resistance is also influenced by local control. The local control mechanisms, as we'll see, are going to be very important to helping to match the amount of airflow with the amount of blood flow in the lungs, our ventilation-perfusion ratio. Airway resistance is going to tend to be greater during expiration than during inspiration. And the way that works is that during inspiration, just as the alveoli are being pulled upon by the slightly negative pressure in the intrapleural space compared to inside the lungs and a greater transmural pressure, is that as the lung expands, it's not only pulling the alveoli open, it's pulling the airways open too, thus increasing the radius and decreasing the resistance during inspiration, such that people who have elevated airway resistance in certain pulmonary diseases will have a harder time moving air during expiration than during inspiration. One such example are in our chronic obstructive pulmonary diseases, such that we have elevated airway resistance. So again, the air movement is going to be more difficult during expiration than during inspiration. Obstructive pulmonary diseases include chronic bronchitis, asthma, and emphysema. A summary of factors affecting airway resistance are described in Table 13-1. Again, we have autonomic control that can cause constriction and thus reduce radius and increase resistance to airflow. And for a given pressure, a greater resistance would mean lower flow. If we have a decreased amount of CO2 locally, that would cause constriction as well. Pathological factors could be allergy related, partly related to SRSA, leukotrienes. Leukotrienes, I point out, their production is inhibited by certain medications like montelukast, which is also called Singulair. And also you might take antihistamines to reduce some of those allergy related symptoms. Could also be caused by physical blockage, if there's excess mucus or edema of the walls, an increase in water, or airway collapse. Bronchodilation, the opposite effect on radius, and greater radius, so less resistance, and for a given pressure then you tend to have greater airflow. Sympathetic tends to dilate, but mostly circulating epinephrine in response to sympathetic stimulation. Remember, beta-2 adrenergic receptors are mostly responsive to epinephrine with very little response to norepinephrine. An increase in CO2 would cause in the area would cause dilation in the airways, which would improve airflow and help aid our ability to clear carbon dioxide. There are typically not too many pathological factors that would cause airways to be over dilated.